Welcome, everyone. You are at a Doc Talk, Accessing Healthcare in Canada. We're going to give people just a minute or so before we get started, but just want to make sure you're at the right place. These are not Lucy reruns. This is a Doc Talk. It's a beautiful sunny day out there, but we'll get you back to it quickly, and this will keep you interested for a while, I promise you. All right, well, maybe we'll just get going. My name is Jeff Malmgren. I work with the Burnaby Primary Care Networks, under whose auspices these Doc Talks take place. There's a series of Doc Talks online, and we'll talk to you a little bit more about that later. Accessing Healthcare in Canada is the title for our Doc Talk today. I don't see the presentation. Maybe we can pull that up. There we go. Thank you. And we can go to the next slide as well. Can we go to, oh, there we go. The Burnaby Primary Care Network respectfully and gratefully acknowledges that the work we do takes place on the unceded territories of the Musqueam, Squamish, Tsleil-Waututh, and Coquitlam peoples. Each nation has distinct histories and distinct traditional territories that fully or partially encompass the city. Burnaby is very interesting in this way. We encourage you to learn more about the host nations whose ancestors have occupied and used these lands, including parts of present-day Burnaby, for thousands of years. Thank you. We can move. So this talk has been created to help newcomers understand and access healthcare. There will be resources provided to you that will help you understand cultural differences and guidelines, and it's designed to answer some common questions and guide access to the service. I do want to say that this talk is being recorded, and in fact will be available online on the BurnabyPCN.ca website, along with all of the other Doc Talks. There's quite a big sort of library of Doc Talks that we're building up there, and they're very easy to access, and you can utilize them. We won't take questions during the presentation, but once the formal presentation is done, we think we'll have plenty of time to answer your questions. So if you do have questions, please put them in the queue. There's a little slot that you can say questions, and you can put them in those questions, and we'll do our best to answer all those questions. If by chance we don't get time to answer them all, we will make sure that we do the research and find out what those questions are about and post them on the website along with the Doc Talk afterwards. We can move to the next one too. So I just want to speak briefly, and Dr. Wong will speak more in more detail about this project itself. This is a project under an initiative called Shared Care. And Shared Care is a provincial initiative that supports the sharing of care particularly across medical disciplines between family doctors and specialists. In Burnaby, we take a slightly broader take with how we shared care. We talk about how we share care across the specialists and consultants in the hospital and in the community, the family doctors, but also in the community as a whole. So many of our shared care projects really do have a strong element of community in them. And this one, as you'll hear, very much does have that. And we can go to the next slide. So we're really lucky tonight to have some great presenters with us. I've met them before, and I've seen their work, and I just see the work of this project, which is really quite astounding. Dr. Ana Pasantes is earned her medical degree from I'm going to do the Spanish very badly. I promise you this. Pontificia Universidad Católica del Ecuador. It's best I can do. And completed her family medicine residency through the UBC at the Fraser Health program. She currently practices at Kensington Medical Clinic in Burnaby. She maintains a comprehensive longitudinal family practice, serving a diverse patient population. But in addition to community-based care, Dr. Pasantes provides medical support to residents in long-term care and assisted living facilities, reflecting her commitment to continuity of care across the lifespan. Her dedication to the underserved communities extends beyond Canada. Dr. Pasantes spent 1 year working in the public health system in the Amazon region of Ecuador, delivering primary care to remote and marginalized populations. She's also volunteered on short-term missions with organizations such as Samaritan's Purse. These experiences have shaped her culturally sensitive, adaptable, and community-focused approach to family medicine. And Dr. Carrie Wong is a graduate of the University of Alberta Medical School, where she also completed her residency in obstetrics and gynecology. She has over 2 decades of experience, having maintained full-time community-based OBGYN practice at Burnaby Hospital until 2019. From there, she transitioned to an office-based practice, specializing in menopause management and women's health. She currently serves as a physician co-lead for the newcomers Women's Health at Fraser Health, where she leads initiatives to improve healthcare and accessibility for women and families with communication barriers. Dr. Wong also holds leadership roles within the Burnaby Shared Care Steering Committee and the Sexual and Reproductive Rights Committee of the Federation of Medical Women, excuse me, of Canada. So I think you hear these are the right people to talk to you today, and I'm really greatly pleased to be able to turn it over to them.
So thank you, Jeff, for that very kind introduction. I'm Dr. Carrie Wong, and I'm absolutely privileged to introduce one of the key initiatives from our project. So together with my colleague, Dr. Presantes, and our team at the Burnaby Division of Family Practice, we've been working on a topic that we feel very passionate about, and that's specifically improving access to healthcare when language barriers exist. Really, if we reflect back, Canada really prides itself on universal healthcare. And our community is so rich in cultural and linguistic diversity. But with that diversity comes challenges, especially when patients and providers don't share a common language. And these communication gaps often create invisible barriers, leading to misinformation, misunderstandings, and ultimately poorer health outcomes. The research consistently shows that better communication leads to better care. It leads to less visits to emergency care. It leads to better long-term outcomes. And that's why our project focuses on reducing these barriers through partnerships, education, and better access to interpretation services. So again, tonight's Doc Talk will provide information to our community members about accessing healthcare in BC. And this talk will be recorded, as Jeff has said, and will be then also subtitled in multiple languages, so it will be able to reach a more diverse audience. Really, the bottom line is our goal is to help every patient feel heard, understood, and supported, regardless of the language they speak. So to start off with, what is healthcare like in Canada? Well, there is a very significant focus on preventative care, helping patients stay as healthy as possible. In general, much of your healthcare is covered under the Medical Services Plan, and this would include access to doctors, nurses, and other professionals. These care providers will work as a team, a network, often providing different but very important aspects of a patient's overall care. The first point of contact should be usually a family doctor or, in some cases, a nurse practitioner in BC. And your patient may be attached to a clinic, or they may access this care through a walk-in clinic or an urgent care clinic. And we'll get into more details about these access points later on in the presentation. It's also important to know that there are some services that are not covered under MSP, such as dental care, eye care, physiotherapy, massage therapy, psychological assessments, and counseling. But what can patients do when they're trying to seek healthcare, but they don't speak English? And specifically, what resources are available for a patient when they're attending their appointments? There may be many options available, but they varies from office to office. So it's really important to plan this in advance. Ask the office if they have any language supports, if they have any communication aids. To start off with, PLS, or the Provincial Language Service, is a great resource, but it may need to be organized in advance, and not all offices have the resource or the time to organize this during the appointment. The Provincial Language Services provides interpretation services in more than 200 languages, including things like American Sign Language. And these interpretation services are available 24 hours a day, 7 days a week, and they're provided at no charge for BC patients and or their families. Other things to consider, some office may be able to use translation apps such as Google Translate or DeepL. And some office may recommend you bring a support person that you're comfortable in sharing your medical information with and that they may be able to translate for you. But the bottom line is to look into this in advance so you're not struggling at the time of your appointment.
Um, As Dr. Wong was saying, one of the idea of this webinar was to give you the access points into the medical healthcare system. So your big entry door will be family doctors or nurse practitioners. Your first contact always needs to be a family doctor because they are the one that will run an assessment and then they will connect you to the services that you need. The places where you can find family doctors are mainly family practices, and that is when you are connected already or when you want to make a long-lasting connection with a family doctor or a nurse practitioner or a walk-in clinic. Walk-in clinic is more like like shorter appointments, different doctors, not always the same. In general, family doctors and nurse practitioners help with general checkups, with non-emergency checkups, with your any needs. We usually say from your cradle until you're old. So we can do initial assessment, initial testing, and initial treatment. If something is more complicated or we believe that we need to connect you to a specialist, we will refer you to the specialist that you need to see for addressing your health needs. In general, to see a family doctor, you need to book in advance. Depending where you go, wait times can be up to a week. For walk-in clinics, especially for in-person appointments, it can take a little bit longer. So you need to research the clinic you want to be seen where they offer this type of service and make sure that you're following the instructions on how to book an appointment. Sometimes for walk-in clinics in particular, you cannot book in advance. It has to be on the same day booking, and you may need to sometimes it's first come, first serve, sometimes a little bit in advance. It depends on the walk-in clinic that you're attending. How to find a family doctor that speaks your language. The big registry for all doctors that have a license in BC is the College of Physicians and Surgeons of BC, and that will be the cpsbc.ca, which is the website where you can just select your language and see which physicians speak your language. In general, if you want to meet a doctor that speaks your language, asking family and friends or your community for suggestions can help. Most clinics will and most doctors will still require for you to bring someone to interpret, just to make sure that you're being connected to the right person. I find that connecting to a person that speaks your language sometimes a little bit complex. So being prepared with that other person that can do a translation for you is really needed. In general, if you are having a problem with your health, there's many ways that you can get a connection with a doctor or you can have some questions answered. First connections that we have here on this slide will be the Fraser Health Virtual Clinic. This is a clinic when if you have a question, you can talk to a nurse. It's usually open from 10 a.m. to 10 p.m. And the nurse can tell you if it's something that you can take something over the counter or wait at home or you need to see a physician. And they sometimes will direct you to where do you need to go. There's another phone number that will be their HealthLink BC or also known as 811. You also have a nurse there. They are available 24/7 and they can also help you a little bit with the health advice. The benefit of the HealthLink BC is that they have interpreters available. And if you are having a problem with language, that's the best place to connect. They may direct you to a place to see a doctor. There are three places in particular. One is the one that everybody calls a UPCC and is known as an urgent and primary care centers. This one, it's a place where you can go for urgent, but not life-threatening issues. They usually see things like sutures, colds, urine infections. They don't have any equipment on this urgent primary care center, so it'll be basic things that you still need an assessment to make sure that you don't need any antibiotics antibiotics or any other medicine, but they are also able to do minor procedures like the sutures. Um, if if you have something more complex, um, ideally you should be seeing your family doctor, but if you don't have one yet, your next point of connection will be a walk-in clinic. In a walk-in clinic, it will be something more complex. Like I have high blood pressure and my blood pressure is really high and I need a little bit of follow-up, or I need a change on my medications. I have diabetes and my blood tests are not normal. That's mostly chronic things that need a little bit of help from a doctor that should be managed in general by your family doctor or a walk-in clinic. If something is serious or life-threatening, that's when we have the emergency department. So we do have the 911 that it's the phone number that you can call if you cannot leave your house and you need transport, and for them to connect you directly to an ambulance for you to be brought into a hospital. Or you can also go into the hospital in the emergency department. The emergency department does not manage chronic things or non-urgent complaints. They usually will see you if you have pain that is not getting better or is getting worse, really high fevers that are not getting better after antibiotics. They like a fracture, so things that require a little bit more of testing, and then that can be threatening your life, right? As I was saying, Fraser Health Virtual Care, it's a nurse mainly available from 10 a.m. 10 p.m. They do have interpreters, but they do not have them available all the time. But you need to say your language in English 3 times. You can find more information about this clinic in the fraserhealth.ca/virtual care, or call to the phone number that is on the screen right now. The UPCC again is the Urgent and Primary Care Center. Minor ailments, you need an appointment to be seen on a UPCC. You need to look online for UPCC on your area. They usually do a screening over the phone to see if your concern is something adequate for them to see. And then they will book sometimes an appointment for you to follow up with a physician for have the right treatment. After that's when they will give you an appointment. This one, they are very clear that they don't manage chronic conditions or complex health conditions. And this one is mainly for episodic care, meaning if you have one ailment like a cold, urine infection, or a suture, something that you need to see that doctor for one time only. Walk-in clinics, this can be offered in a virtual or in an in-person. Virtual services are mainly for things that the doctor will not need to do a physical exam for you. Medication refills, mental health, or follow-ups is usually very adequate for virtual health. But if you have concerns like lower back pain, knee pain, skin conditions, as somebody needs to check your stomach for abdominal pain, stomach pain, or I'm having my heart racing. All those things require a physical exam. So making an appointment in person will be necessary for you to have the right diagnosis and assessment. The walk-in clinics are different, and the person or the doctor that you will see can have different level of knowledge about a disease that you manage. There are some doctors that do mainly walk-in clinic for maternity. There are walk-in doctors that do general ailments. There are some other doctors that also do like chronic pain. Usually if you go into the website of the clinic that you're looking into, they will let you know. Or sometimes you can have an appointment with a walk-in doctor and then they will redirect you to another family physician that can also help you with your condition. In the walk-in clinic, they usually manage more complex health concerns. This is mainly for patients that don't have a family doctor. If you have a family doctor and you have a complex health concern, you should be going back to your family doctor. telehealth options are available. There are many telehealth options available. There's also some private options nowadays. Definitely look into the publicly funded, but there are a lot of options for walk-in clinics. Your family doctor. So, as I was saying before, a family doctor is your main point of contact. They are usually the ones to connect you for all the healthcare services. The role of a family doctor is to prevent disease, and in that prevention or that screening, they find some abnormal tests or abnormal exam. They will follow up ordering tests, or they will discuss with you the different treatment options. Usually, a family doctor needs to do their initial assessment and their initial testing and initial treatment before thinking about sending you to see a specialist. Finding a family doctor, it's a little bit complex, but nowadays we have two services that can help you connect when family doctors that have a space on their practices. One will be the Burnaby Divisions of Family Practice. They have an area where it says looking for a doctor, and you can put a name on a wait list, and they will connect you with doctors that are within the area of Burnaby that you can have an initial interview and to see if it's the right fit for you and for your healthcare needs. The province now has Healthcare Connect Registry, which is the provincial attachment. With this provincial attachment, they are trying to connect patients that are not connected already to a family doctor to be able to close that gap. Because, as I said before, walk-in clinics are good for very simple things. For more chronic things, for more screening, for more follow-up, a family doctor is what you need. And then they are the one that will connect you with services.
So moving on from family doctor services, when you need a specialist in BC, seeing a specialist usually starts with a referral, and that can come generally from your family doctor, but also from sometimes the walk-in clinic, sometimes your emergency visit, or your visit to the UPCC. Now, specialists are doctors who focus on a very specific area of health, like heart disease or like surgical procedures. And so these are the doctors that are trained to manage potentially more complex or more focused areas that are outside of the scope of your family doctor's practice. It's important to understand that your family doctor and your specialist work together. And so often when your reason for seeing the specialist, the condition that you're seeing them for is resolved, you will follow up with your family doctor for ongoing care. As well, because specialists are a referral basis, the wait times to see a specialist can vary. Sometimes it's just a few days, especially for urgent or emergent problems. And in other cases, it may take several months, depending again on the reason that you've been referred to the specialist, as well as the type of specialist that your family doctor thinks you need. Most specialist care is going to be covered under MSP, our provisional insurance program, but there are some exceptions, like some procedures or some assessments that might not be included depending on the situation. As well as if you don't have any MSP coverage, then those visits to your specialist will be charged privately. So it's important to get MSP, and if you don't, to ask what the cost of this would entail. So going back to a bit about 811 and our HealthLink BC, so while referrals and appointments and connections with your specialists are key to our healthcare system, they will take time. And sometimes you may need healthcare or at least information about what to do more urgently. So again, in BC, there is a free resource for everyone to ask for medical help and to decide on what your next step should be, and that's called 811 or HealthLink BC. You can call this number anytime, day or night. It's available 24 hours a day, 7 days a week. And you can ask them your questions, you can ask for advice, and you will be speaking directly with nurses, dietitians, and pharmacists depending on the time of day. Again, there is interpretation available in up to for over 130 languages. Really, the main goal of 811 is to guide you, whether it's to doing something for your own care, picking up something at the pharmacy, directing you to call a clinic, or directing you to emergency services. It's a great step to do when you really don't know what to do. So again, calling 811 is a great place to start, but then there are some situations that are more urgent, and knowing when to go to the emergency room versus a walk-in clinic can make a very big difference. So we're going to talk a little bit about the difference between emergency and non-emergent care. So, for example, if someone is having chest pain, if they've had a severe injury and significant bleeding, or you are concerned about having a fracture, or they're having trouble breathing, or signs of a stroke, we don't want you to wait. We want you to call 911, and we want you to go to the emergency room right away, because these are serious and potentially life-threatening issues. We want you to get the care as quick as possible. But on the other hand, if you have things like a cold or a flu, or if you need prescription refills, or if you want to confirm that you're pregnant, these are not emergencies, and they can be handled by other facilities like your walk-in clinic, like the urgent primary care clinic, or even calling 811 for guidance as to what to do. The bottom line is we want to use the emergency room only when it's truly needed. And that allows us to keep that care and that availability open for more urgent cases. It's also really important to understand that when you go to the emergency room, the wait times can be quite long, and it really depends on what you're there for, because the cases are going to be triaged based on the urgency. It's not a first come, first serve situation. So you may go into the emergency room and you may see patients walking in to be seen by the doctors, even though you had shown up to the emergency room first. Emergency room care is covered under MSP, but if you don't have MSP, again, the hospital may charge you for your visit and your care.
So, Doc, the first question that I always have from a lot of patients that are newcomers is where do I go to look for care? But the second question that we always have is how much I need to pay for this care, right? So Dr. Wong was talking about the medical insurance, which everybody call here is the MSP, which will give you what everybody's gonna ask you when you're trying to access care. Which will be your PHN, which is your healthcare number. If you have a visa, working visa, permanent resident, citizenship, you need to apply for the medical insurance. Medical insurance is not something that you get automatically once you land. You need to apply for having health coverage. MSP, or the medical insurance, is what's going to pay for all of the medical services. The one in BC usually ask you to apply the moment that you arrive, but sometimes they can take up to 2 months for it to actually kick in and for you to have your number to be able to visit a doctor. In that gap time, sometimes on all the immigration paper, they will tell you you will need to cover your healthcare with private insurance, because if you don't have medical insurance and a PHN, if you go to any facilities, urgent care, walk-in clinic, or a hospital, they will charge you for the services that you need. If you are a refugee, there is a different type of insurance that is called the IFHP. They usually give you, it's a paper that you have to bring with you to doctor appointments, and usually tends to cover people up to 12 months. Whenever you're going to want to see a doctor, or you're going to contact any health service, laboratory, x-rays, ultrasound, you need to bring your BC service card or your PHN with you, because they need that number to connect to your insurance for it to be covered by your insurance. Without this card, they may charge you privately because they don't have the number that will cover you, right? There is a lot of information on the provincial website about MSP. If you Google how to apply for MSP, you will find there is a process that you just need to either talk on the phone with a person or fill a form. You need to do that as soon as you are eligible for that. We, if you don't have MSP, all of the services that you need will have a private charge, meaning that you need to pay for the services. But even when you have insurance or MSP, there are some services that will not be covered under your MSP. This is mainly for anything that is considered not medically necessary. This is very common, especially for tests. Usually family doctors and specialists follow Canadian guidelines, and we think those guidelines that they tell us what should we request for blood tests. Sometimes there are some other countries that will request more extending testing or some tests that are not part of our guidelines. Our laboratory can do those tests, but your doctor may redirect you to a person that can ask you, it can help you with a requisition for them, and you can pay for them privately. Or there could be more advanced tests that you will not be eligible for, and then you will be required to pay for that. Usually, it's something that they will tell you in advance before doing any testing, and this also can happen with procedures, especially cosmetic ones, and certain treatments. The price will depend on the service that is being provided, and things that are not covered under your MSP will be other services that are also considered part of the healthcare. Physiotherapists, naturopaths, chiropractors are not covered. Optometrists are partially covered and sometimes depend on what ailments you have. But most extended health or private health can help you cover some of these costs.
So, in terms of our project, we were able to develop 3 new resources to provide easy access and effective places for patients to land to improve their communication and to improve how their medical care can progress. So I'm really excited about these resources. I think they will make a huge difference in terms of how patients who may have more language barriers are able to navigate healthcare in BC. So first of all, there is going to be a menu-driven directory on Burnaby's primary care or primary network website, and this will provide links to vital information on healthcare, access points, cultural norms. So this is the shared care accessing healthcare in Canada page. And although it's still under construction, it will be going live later on in August. And then our webinar participants will be made aware via email when this page does become accessible. Secondly, on Pathways BC, there's going to be a link for fillable patient intake forms available in English and 8 common languages in our community. Can we go back to that last slide for a second there? Thank you. So we'll talk a little bit more about Pathways BC shortly. And finally, as we stated earlier, a recording of this doc talk will be available in multilingual subtitles, as well as a sidebar of helpful links to resources that will support, again, our non-English speaking patients. Next, thank you. So Pathways BC is a great landing point. This is a site that provides valuable resources, supports, and useful information at both the local, the regional, and provincial levels. So on the site, you will be able to find a PDF fillable multilingual patient intake form that is a very standardized form. It includes things like a checklist for patients to fill out their past medical history and to provide like the critical information that will is necessary to facilitate their care. Now, these forms can be downloaded and they can be filled out by the patient in advance, or they can be printed out at the doctor's offices as well. The benefit is if they do get an opportunity to fill it out in advance, they can use like their translating device. They can use a patient friend to help them fill out the forms, so they can bring this information. And again, stated it was like a standardized form. Like this is the same form that's used for like surgical bookings. These are the key important health pieces that are important for the medical care providers to have. Um, so if you scan the QR code for access to Pathways Burnaby, once you get on that page, you can scroll down to community services, news and events, and you'll find a direct link to these forms, or you can put in the search engine patient intake forms and it will bring you to those forms as well. The bottom line is for us with developing this project, we want to help our patients again, even if they don't have a shared language, that they can have the resources necessary to communicate effectively with their care providers. So whether or not you are new to Canada or you're assisting someone navigating the healthcare system for the first time, these tools are designed to help patients be empowered with the knowledge and confidence to ensure your healthcare is optimized. Now, our resources are going to be regularly updated to ensure that you have the latest information. So there's going to be additional resources to come as well. So we're going to open the panel to questions and answers now then.
Thank you. Oops, I'm going to stand up so you can see my face. Well, that was great. Thank you. I really appreciated. It gave me some thoughts that I'd like to ask, some questions I'd like to ask. I do want to remind folks in the on the webinar that you're welcome to put questions in the Q&A. But I actually one of the questions I had, I mean, and I know that this is a tremendous amount of work to support our patients in the community to be able to better access care. But I think at the same time, from my understanding, there's also work being done to support our physicians to be able to better work with, to be better prepared to work with folks from a lot of different communities. Can you speak to that at all as to what it's like for a physician and to try to understand how, not just language, but culture is different and how to work with that? Are there supports that are available for those doctors?
This is a great point actually, and there's more work that's being done at many centers at many levels about this. And the reason is we really now understand that if we as physicians, as healthcare providers, understand culturally our patients, that if we are even try to engage in what we can to improve communication, ultimately it improves not just our medical care and our outcome, it improves the trust, it improves the rapport with our patients. There's been studies that have been done about this, and we find out that by trying to improve our respectful cultural discussions with our patients, that they share more and that we learn more. And ultimately, their outcomes do actually improve. And that's why there are funds that are being put in to try and help these. The problem is that again we live in a very cultural diverse society, and it's challenging to see all these perspectives and viewpoints, and physicians who are working hard to keep up to date on their medical knowledge and the current protocols and so forth. This is often something that can be easily forgotten. So again, part of this project is to bring this to the forefront. We know from many studies that say that if we engage in culturally appropriate care, outcomes like maternity care, especially in the United States, when physicians are more understanding of cultural norms, babies do better, moms do better, people live better. So there's great work that still needs to be done on it, but we've definitely started to carve our way into this.
Well, and I guess that's a, I mean, from my understanding, and I mean, you guys know this better than I, but some of the barrier, there's always language barrier, but there's a certain level of for newcomers in particular who are trying to navigate their way. The resources you're building are incredibly valuable, and part of it is getting through the stigma of not knowing or feeling like you don't know. To me, that what you talk about is if there's an avenue of cultural comfort that people feel like they can come in and be comfortable, that's going to create going to create much more access. It's going to actually get people to the point of accessing care. Is that Dr.
I have had that experience. I do serve a lot of communities that have more like a Latino background, and at times I do find that they mainly look to discuss their medical needs with me because they feel that I will understand better what their needs will be. And sometimes having that conversation is needed for them to let them know that the treatment that they are receiving is the correct according to our guidelines. And sometimes understanding your background and your expectations according to your previous experience that you had on your country can also help connect and understand. And I find that that trust helps their health as well and has a better effect on how they recover or they feel better after feeling that they've been understood.
Mhm. I mean, I think that my belief is that, and Dr. Wong, you spoke to, it's hard for physicians to to understand however all these cultural differences, but for family doctors, it may be a little bit because they're building relationship, they have direct patients. But I would imagine some of those episodic care, places of episodic care, like, well, be walk-in clinics, even the UPCC, but even most particularly the ER, those must be difficult places for newcomers to come. You spoke to, some of the pieces around it, but can you speak a little more to understanding the difficulty of that and and if there's anything that folks should really be thinking of as they walk in those doors? I think my fear, I guess, and I think I heard you say it, is they won't.
So there's actually some, again, great data about this. The by the time that these people end up in ER, it's because the rest of the preventative care, the access to all those other points have either failed them or they didn't know how to access them, and that's why they end up in emergency care. So now you have a patient who has uh, already some distrust in the system. They're there in emergency. They're not really even sure why or what's going to happen from this point onward. And now they're thrust into a much more frightening and acute situation. So I completely agree with you. Like when they get to emergency, that's a point where they feel that they need that communication, and all those pieces before them somehow have been lost.
Yeah, and I mean, it's this to some degree, it's the same for all of us. And when we get to the point of the ER, and particularly these days, as we walk into ER, we don't know what to expect. And I would imagine that if I'm a newcomer and I haven't even heard about that experience, it would be shocking. So there would be places where it would be shocking. Do you know if there's any? I wanted to touch on. You spoke about and certainly the idea of bringing someone trusted with you. This concept of peers has been talked about in the hospital for a number of different folks who may have trouble accessing care. Is are there are there peer services available for newcomers through the community at all that they can access? Do you know?
I'm not aware of any. Anna, do you have any? Dr. Pasantis, do you have any idea of if there's
Um,
anything available?
so there's this idea of new clinics that are popping up right now. One is the Mosaic Clinic that they open in the Burnaby area, which is their focus is more into language and community. And what they are trying to do is to help people with certain languages be able to prevent before they end up in emergency. And there's another clinic that is called the New Canadian Clinic that also has the idea of having interpreters into their system to be able to have better understanding of the health. We also have the umbrella clinic, which helps you with the health navigators. So they kind of like explain to you how the system works, but they also speak your language and usually are from your culture. So then you can make that connection. By the time that you get to the hospital, though, the hospital do have access to interpreters. But it's usually a little bit complex to connect with those services, but they are available especially for serious conversations, and then they usually have to set up a time. The service is free to patients and is free to physicians. And then it could be either by video or in person, depending on what the need is. Uh, but there are connectors. The problem with the services is they're a little bit more complex and you need time to set around them. So in case of emergencies, that is a little bit more difficult. And that's why having a person that speaks your language but also can translate what's happening is important when you're accessing a point of care. Because by the time that we can find the right connector for you, it could be after a few things have happened, right? I've also had an experience that the BC Cancer Agency, if they find that there's a limitation on the language, they will have an interpreter pre-scheduled if you have a pre-scheduled appointment, right? So there are services there are available. There are services available at your family's doctor's office too. We have the PLS system, right? That the doctors can access. The main limitation that we have with those services is um, we need to prepare. Again, it's time. We need to prepare to be able to make that connection. We need to have the video or the phone, and sometimes, depending on how the office is set, it can be difficult. And as part of the shared care project, we also try to use apps. Google is not the best, but some of the translations is better than having no translation. But definitely having a person with you is better. And we've been trying a new app that is called Deepl, is Deepl, which uses a little bit of AI to improve the translation. And when we were running our project, they did found that the comparing with other translator, Deepl have better grammar when translated to a different, but still make some mistakes. So there are options. Most of them need to be planned.
And that's the tricky part. Yeah.
Hmm.
Yeah, and I know, and just letting folks know. I mean, with these guys, I'm not trying to put them on the spot here, but it's really interesting because and really that this focus on particularly, ideally, you have a relationship with primary care provider with the family doctor because that will help you navigate and in many different ways, and that's the ideal situation. But I wanted to, because the other piece that came up for me as you were speaking was, and we've talked about this in other shared care projects, was lab services and accessing diagnostics and lab services. And I think Dr. Wong, you spoke to it briefly, but those are other places where, in our day-to-day, we say, okay, go get a blood test. It sounds great. Go get a blood test. How do I go get a blood test?
Totally. Yeah.
And you need an MRI. Okay, what is that procedure? And is that is that an amplified risk? And
Absolutely. Oh my goodness. Like there's challenges not just getting through, like, say, our office, but when our front staff provide them with their next points of management and investigations. Those are key things that need to be done. But we'll have patients who show up at the life labs for their ultrasound test, or they show up at our office for their blood test. And it's really of no fault of anyone's own. We try our best to communicate that information with the patient. Um, and we feel like they've understood and we used all of the resources that we have, but just not knowing how the system works here makes it so much more challenging and it delays things. It delays their diagnosis, it delays their referrals, it delays management plans. So these are all such key points in a patient's healthcare that that seems simple when you and your patient speak the same language, but can be absolutely challenging when there are these, again, invisible barriers. We say that healthcare is universal, and yes, that lab is out there, and yes, you can get it with your MSP, but if you don't know how to walk through the door, then it's not really accessible.
No, and I mean, even, understanding that although it is accessible with your MSP, it's a separate system that's not run by the government. It's actually, in particular, when we're talking about lab services, that's actually a separate company. And if
Mhm.
you want to connect them, you need to go through their website, and that's a different process unto itself. And I mean, I'm ignorant of this. I don't know if Life Labs has much in the way of direct support for language. I don't know that. Do you know?
That's a really good question.
Yeah. No, I was curious.
Yeah, no, I think depends on the people at work and a particular lab, because
Mm-hmm.
there's a lot of workers that do have a second language,
Yeah.
but I don't think they have, because they are a private company, right? They are not, I don't think they have a lot of resources. But one of the things that I wanted to mention is, and that was kind of like the purpose of this project, in the purpose of the page that we created with all of the resources. We did put links there that will connect, like if you, where do I go for a lab test? There is a link there that is going to redirect you to Live Labs. Sadly, it's not complete at this time, but we're going to send an email with the link for that and the chatbot later when, in the next couple of weeks for people to be able to access. But this is gonna remain in the internet for people to be able to access the information. And the information that we have there is really good. It's like, how can I apply for MSP? What is MSP? Where can I find a family doctor? Where is the lab? Where can I find services? How do I contact a UPCC? Everything that we have spoke about today on this DocTalks will be on that landing page with a
Excellent.
link that will give you the right information.
Yeah, and I mean, I do think, I know that when I get an MRI, I I get something that says this is what an MRI is. This is what's going to happen to you. This is and I my guess is that that stuff is not as easily found in a translation as some of the other stuff. So if those resources get built out, that would be fabulous. That's a great project. Yeah. So and before I let you go, I mean I think this is a great conversation. The other one that came up for me because I know particularly over the last 5 years, that we've seen such an increase across the population with issues around mental health, but particularly in the newcomer population. Have you a focus on that? I mean, because you talked about referral to stuff within the system, but a fair amount of the supports that are for that people are may be able to access aren't necessarily within the system, within the tighter system. Does this project reach that, or do you have is it true? Do you see that as an issue for folks for newcomers in particular?
I mean, my personal feeling on that is our primary care providers, our family doctors are so critical in that piece. Like
Mm-hmm.
uh, I can't thank them enough for all that they do, providing that type of holistic care. Because really without them, I couldn't do what I do. So I would applaud my primary care providers for all those pieces and to for the project, I think giving them the resources that help our primary care providers have, like I said, like patient intake forms and how help them streamline that information gathering pieces will help them provide that type of care. So doesn't our project doesn't address like the mental health piece specifically, but just having them access that primary care point is going to be so critical again in their holistic health.
Getting that link, absolutely. Well,
And
thank
I
you.
really
Yeah,
and I
yeah. Go
really
ahead.
think
Yeah.
that this will be this project is an open door to reach more right now because it's the beginning of a project. We wanted to go directly to the core, which is your family doctor appointment and your specialist appointment. But I think that this project can expand more into all of those other services that you're mentioning, because there should be access a little bit more wide within your language so you can understand your health.
So as you, this is where I am a little bit putting you on the spot, 'cause I'm curious about this. As you build out this project, will there be room for folks from the community to be able to say, I looked for this and it wasn't there? Is there a possibility to get that resource? Is that a possibility?
That's great feedback. I think we should take it back to our shared care committee and place it on our next agenda. I think that's a great point.
To me, I think Dr. Pasantes, your point is a great one, is that if this tool is good and it's well used, then it will grow. And if it grow, and the way that it will grow is if people find what they need on it. So that sometimes it's thinking we know what they need, and sometimes it's actually listening to what they need. So, but it's an excellent project. Thank you so much. I think that did either of you have anything just to wind up before we close today?
I just wanted to thank everyone for the opportunity to do this. I think this is a great point for us to be able to reach out to people. And again, I appreciate everything that the team has done to facilitate this project.
Excellent. Well, thank you again. I think as you'll see, if you want to go to the BurnabyPCN.ca website, you can access the resources we've talked about already. You'll be able soon to be able to access this doc talk as well as in a translated form. So I'm hoping the folks who have joined us will be able to share it with people who they know will be interested. And there will be more resources come up as we go along. I'm just going to ask our admin folks, was there a survey or anything at the end of this? Did we have to do anything like that? No, we don't have to. Great. Well, thank you again. It's been a pleasure for me. I hope it's been a pleasure for you, and we'll all go back out and enjoy the sunshine. Take
Thank
care,
you.
everyone. Bye now.
Thank you.